The frustration when somebody comes in late with diabetes or a stroke, I thought this shouldn't have to happen. Like, people knew everything, they don't have to be doctors, but like the basic, then maybe our healthcare systems wouldn't be so hard. We're not practicing healthcare, we're practicing sick care. Healthcare shouldn't just be about treating diseases, it should be about protecting health before it breaks out. And knowledge is medicine. When people understand their health, they make better choices.
Do you think the future of care has to look more human?
The future, it can't just be health tech, it has to be both human and tech.
Hello and welcome to the Uprising Show. And today I have a very special guest, not from North America this time. This time we have a doctor from Sweden. So this is going to be exciting. Sara, welcome to the show.
Hi, thank you so much.
So Sara,
I'm really glad to be here.
Yeah. So before we go into the conversation, for our listeners, give us your brief introduction. Just 1 minute.
My name is Sara Loden. I'm a physician from Sweden and also the founder of Proact Life. And my passion is moving healthcare upstream, before diagnosis, before crisis, by focusing on prevention and health literacy. And I'm excited to share my journey and vision with you today.
Yeah. So we're going to talk about a lot of that, but first, let's start at the beginning. Like, where did you grow up? What originally got you excited about medicine? And was there a moment early on when you realized that this is what I have to do? This is how I have to become a doctor. What was it?
Yeah. I actually grew up in a really small town in Sweden. It was like 5,000 inhabitants in the whole community. And later I moved to Uppsala, where I studied. And first, when I was 19, 20, I really didn't know what I wanted to do when I grew up. So I studied a lot of things. I started study art history, and then chemistry, and then biology, and then social geography. And when I studied social geography, we were away in a town called Strömstad in Sweden, and there we had a task that we should count cars at one of the biggest highways in Sweden, and that was so boring. And on that night, I just got like an epiphany. I should be a doctor. And my mom has always said that to me before, and I was like, no, I'm not becoming a doctor. I don't like blood. But it really hit me that night. And I remember calling my husband and told him, and he was like, okay, this is not one of your ideas. But actually, I was serious. I studied my grade a bit higher, and I finally got into med school when I was 25. And I have never regret that. It's truly amazing, actually.
Wow. So none of your parents were doctors or
No,
yeah,
both teachers.
wow. So you just but why doctor? Like why medicine? What made you feel like that?
I have actually no idea. It was just like, yeah, okay, I want to work with chemistry, biology, and I want to meet humans. And yes, of course, I should be a doctor. Why haven't I thought about this before?
Yeah. Yeah, interesting. Wow. And so, and again, I see it, we connected through LinkedIn and you've been open about especially the toll of burnout in healthcare. And what was your own experience with that? And it's we talk about this problem a lot in the US. US healthcare system
Yeah.
is a little everything is too much. So how did it shape the path you are now forging with, especially with prevention and health literacy? Can you talk about that, please?
Yeah. Personally, I never been completely burned out. I'm actually quite good at setting boundaries and saying no. I don't know if it's very common amongst women, the problem of saying no, like work-wise. But so many of my both colleagues and friends have experienced burnout. Some for maybe a couple of months, some for a few years. And we see it all over the country. And I've always thought to myself, it shouldn't be like this. We're doctors. We shouldn't. All of us shouldn't have to be burned out. It's not right. And honestly, I started on LinkedIn for like 8 months ago, and I really thought this was a Swedish problem, like Swedish bureaucracy, the queues in healthcare. So I got actually kind of surprised when I realized it's all over the world. I know I learned that the US has a lot of problems, the UK. I even got a like small poll on LinkedIn and got answer from US, UK, Spain, Italy, Pakistan, India, I think as well. So it's really global. And it's really scary because all of my colleagues, friends here in Sweden, and also many of those I see on LinkedIn, I think we share a passion for our work, but we don't want it to take all our lives.
Yeah,
so that's really sad for me.
Yeah, it is. It is sad, especially, physicians are the one who are providing care for the people, and you cannot pour with the empty cup, right? So
No.
that's a big part of it.
Yeah.
But let's talk about a little bit. Give us how things work at Sweden. So you practice medicine in Sweden, and for our audience, can you break down what's different, or maybe even better, about Swedish healthcare system compared to the US system? I can talk about US system once you answer to add create
Yeah.
more difference. But tell us how things work at Sweden, like how the health system works. Like if someone wants to just give us a basic
Yeah.
of the system.
The Swedish system is built on public health and the principle that healthcare should be equal and accessible to everyone, regardless of income. So we actually, like the last year, we have a lot of insurance companies as well, like private insurance. And I think that's a solution because of long queues in healthcare, and it shows that it doesn't really work that well. But we have it's like a universal coverage, and you never need to pay like big bills or lose your house. So if like primary care visit to a physician costs like $20. And for a specialist at the hospital, maybe $35 and everything. And then we have like maximum that you have to pay in like a year. I think it's $250-$300. And then the system covers rest.
And do you have to like pay in your already in like your income taxes? There's a part of that that says like this is going to your healthcare and this is taken.
No. But we have we have really high taxes in Sweden, like maybe a lot of people know.
Yeah.
So a part of that obviously goes to healthcare.
Yeah.
So it seems really good.
Yeah.
But we have so many issues. We have like the politicians they want all people to be able to seek care whenever they want, and that's really nice in theory. But we have like kind of raised society that don't know so much about the bodies and about sickness and what is life, what is sickness, because life is tough as well. And in everybody's life, so much happening. Like, you know,
Is it the population is more on the older side or younger side? How's that changing?
it's on the older side. Yeah,
So, and
yeah.
and does that have any impact on like more, I don't know, more wait times or more, more education needed? How you were saying people are not that savvy about knowing exactly more about health, just in health literacy, for example. So, what exactly is the problems that leads to probably through this system?
I think one of the problem amongst young people, like 20, 30, they they can seek care for like a crisis reaction. Maybe it has ended with a boyfriend or something, and of course that could be so tough, and it could be really be a huge crisis.
Yeah.
And I really, really understand that. I think we all do, but maybe it's not sickness. It's not something we need care for. It's a part of life, and probably we've kind of forgotten how hard life is. So that's one part of it, and the second part is aging society. So much more people in 70, 80, 90s. Everyone gets older and older, and that's great. But we also have less people working, so it's problems at every direction, I would say.
Yeah. And it's not a big country, right? It's only under 11 million people. So that's like for us it's like less than New York City. So so it's like it's like a very small country in that way.
Yeah,
And it's average age, I was just checking, it's like over 40, which is not that different from US is 38 average age and of population. So but again, US is like also 350 million people.
yeah,
So
yeah.
uh
Did it say that we're 11 millions right now?
yeah, that's it says just under 11 million, 10.57 million based on 2024 census.
Oh wow!
Yeah.
I thought it was. When I grew up, it was only 8 million.
Yeah, I bet.
Uh,
Yeah. Yeah.
so we're
Yeah.
getting bigger.
Yeah, slightly bigger, I guess. In okay, so I guess as a physician who knows who's worked in the Swedish health system, and the things that you know about US health system from a distance, I don't know if you had ever had the opportunity to go deeper into US health system. Are there things that you feel like you admire about the US health system, or vice versa, the things that you admire about both like Swedish system and US healthcare system? Talk about that, because all we talk about is US health system is bad. That's how it is. And there's so many
Yeah,
problems we talk about in the whole every day. So I want to hear from somebody who's like outsider. Are there things
yeah.
that you
I can say like in Sweden, all we talk about is that Swedish healthcare is bad. Yeah, it's actually true. And then sometimes you hear like a sunshine story, like somebody that got care really fast and is really happy. Otherwise, it's just a lot of complaining all the time because long waiting queues. Uh, Patients don't feel like physicians care enough, and uh, people fall between clinics. So it's a lot of complaint here as well. But one thing I think is really good about US system, I think it goes much faster with innovation. It's easier to try new things. It's more like entrepreneurial spirit, and that's okay, because I think with the Swedish bureaucracy, everything takes so much time. So there is no possibility to try new things like really fast. We fall in the same loops over and over again. So that's something I really admire about US system.
And I've spoken the same. I've spoken to people in Canada, Germany, and everybody on the public health system is happy about that. It's equal, universal, but everybody complains
Yeah.
about wait times because then
Yeah.
and how much, and you don't know how much is the doctor caring about you because they just they have a job. At the end, they
Yeah.
will just come and go, right?
Yeah.
So I guess the question here is. Uh, are there any private practices in Sweden at all, or do doctors are allowed and are able to do private practices at all?
Yeah. Yeah. It's kind of complicated, but most like primary care physician, they're all public. Most. Then you can be like half private and half public. Like it's a private company that worked together with the public health system. So it's a private clinic, but the patients pay the same fee and they go by the same rule as everyone else. We have some like small private clinics as well, where patients pay totally private, but not many. And then we have also, like I said earlier, the insurance companies, and I think a lot of workplaces has health insurance for the workers, because they've seen that if we get our employees to healthcare faster, we would earn on that. It's so much better for them.
And
some private clinics, but not many.
yeah, and the one that you were saying, that half private and half public, uh, and they're paid in the same way, so they're just an extension, right? They're just an extension of, like,
Yeah.
public health is there. If you can't get an appointment, try on the private side to get it. But the doctor who's running that, he gets paid in the same way as any public health clinic, right?
Yeah, kind of. I'm employed at half private, half public place. It's the owners are Capio, and they are actually owned by Ramsay Santé in Australia, I think. So it's a big company, and from my point of view, I think it's a bit faster. It's easier to try new ideas, and they're always like a bit in front of the public health care. So that's really nice. Among other things, we actually started with AI for journaling notice. So that's great. It actually helps a lot.
Yeah. And do you help? I mean, we here, like, you have to document a lot, like in the US health system. That's always been one of the complaints from clinician side, that you have to document for your own records, then you have to do it for the insurance company so you can bill it, and then there is, like, afterwards also, then there are denials, then you have to fight them. There's a whole thing here. Does this work like like, how much of that is physicians have to do there as well, like documentation wise and getting paid wise?
It's a lot of documentation, but I could imagine that you have more, because, like you said, insurance companies, and I imagine that being a physician in US always includes the risk of being sued. And we don't have that. We don't get sued.
Yeah.
So that's patients can complain, of course, but we don't get sued. But it's a lot of documentations. But we all our charts are in the computer, of course.
Yeah.
Do you have that as well, or do you write on paper still?
No, everything is digital. Everything is
Yeah.
everything
Yeah.
everything needs to be documented in the health record system. So that's pretty much now the case. Like I haven't heard any physician who doesn't have any HR anymore, and that's a big part of it. So everybody has that. At least that's baseline now. You don't get it.
Yeah.
I don't even think you are allowed to even open practice anymore without having the.
No.
Yeah, so that's kind of where we are, which is a good thing, right? Because otherwise things get lost, and it's like,
Yeah. Yeah.
and then there is HIPAA and all that. We have patient privacy, all those laws. So,
Yeah.
so we have those. Do you have those kind of laws in Sweden too? The patient.
Oh yes. Yes. It's a lot of rules, sharing, and there's so many like stupid rules. One of the latest I've noticed is that if a patient comes to us and is also like seeing a specialist for some other illness, and they have taken lab tests on the hospital, then my clinic don't immediately see those tests at the journal because something with the patient privacy.
Oh,
So it's like the same care, but it makes our work so much harder.
wow. I would imagine, or I would think that a public health system is more like a central health system. So at least you won't have barriers accessing.
We have barriers. We have a lot of barriers.
Yeah. How do you feel about, especially where the world is moving, and especially just for like as a country like Sweden and as a physician there, how do you view healthcare to be moving in the future? Do you see like it's I guess what's the sentiment? Do you feel like it's like Sweden is lagging behind because of this bureaucracy, or it's moving ahead? There are things we are doing okay, but we still need to fix it. Where is your sentiments in terms of where the healthcare is growing in Sweden?
Well, I know that there are a lot of politicians talking about like patient-centered care and moving closer upstream care, and it sounds really nice. So at one side there's hope, and on the other side it's all like all of us working on the floor, and they don't really hear us, and we just get more and more administration, more and more patients. So I really hope that the politicians will start listening as well, because they have a lot of great ideas. I will absolutely go for that, but they need to start listening more,
Yeah.
I think.
Okay.
So hopefully, I am a really positive person. So I really hope it will go well.
Yeah. Okay. That's the hope, right? So, all right. So let's talk about Proact Life. So you have founded Proact Life to move healthcare upstream. Your focus is before diagnosis, before burnout, before crisis. What was, I guess, give us what exactly that mean in your own words, and then what was the breaking point that made you start building this?
I think my breaking point was when I have been so angry, actually, and angry and frustrated, angry at the work environment. Like, it's almost impossible for a primary care physician to work full time because you drown in workload. And also nobody really understands that. So I was angry about that, and so many patients that came seeking care who could have managed their own problems at home. And also like the frustration when somebody comes in late with diabetes or have a stroke because of hypertension. And I thought, like, this shouldn't have to happen. We could have helped these people so much earlier. And I also think, like, if people knew everything, they don't have to be doctors. They don't have to know everything. But like the basic, then maybe our healthcare systems wouldn't be so hard pushed. That's when I kind of realized that we're not practicing healthcare. We're practicing sick care. And I really, and I know a lot of people talk about this right now as well. It's in fashion, so to say. But I also, I feel like a lot of people talk about preventive healthcare, and like the longevity space is growing really fast. But I also think we need to learn and empower patients to manage like small things like sinus infections, sore throats. You don't always need to see a doctor for that. Anxiety, how do we treat life? I think for getting our healthcare system to survive, like globally, I really think we need to start educating people.
So it's your focus with Proact Life is really to educate the population on uh, foundational, uh, I guess, foundational conditions, and then how to keep them away and manage by yourself, more preventative, rather than getting to the position where you need actually the doctor. Is that the core focus for you?
Yeah, I think core focus is like two main traces. First one is like all the risk factors for heart disease and cancer and diabetes, because most of those chronic diseases, they are driven by just a handful of risk factors. And the powerful truth is that by making small changes, you can lower your risk dramatically. And it's like maybe 8 or 10 risk factors. So that's one. And also like how to make behavioral changes, because that's really hard. I know I'm really bad at it. I know how to do it. So that's something we need to talk more about, and how to do it easier and how to really implement that in our daily lives. So that's one like main area. And the other one is educate people about common diseases, common symptoms. When do you need I know you have a big issue with opioids. We have that as well, but not as much as you. But like educate people, when do I need opioids for my pain? When do I not need it? When do I need antibiotics? When do I not need it? And like teach people how to keep track on their blood pressure. Maybe teach them how when a crisis happens, what can I do? What should I not do? And and also like I think our whole lifestyle is creating a lot of anxiety, and maybe that's a sidetrack as well. But the kids playing all the video games, having phones, and I think that all the social medias amongst kids, that is creating so much diseases for us.
Yeah.
And yeah,
Especially on the mental side.
yeah, I haven't read any studies about this, but I guess amongst young girls, like in the social media, it's a lot of anxiety. I think eating disorders are rising again amongst boys. I'm not sure about this, but I know there's so much more diagnosed with ADHD, especially in Sweden. But I think there's a global rise, and I haven't read any studies, but I feel pretty sure that has something to do with all the gaming. There's like, yeah,
All the social media and screen time.
yeah. So
And
I think we need to educate our whole young public about how to live your life. Kind of.
and when it comes to, like, there's a US has its own way how we get any medicine, and even weight loss medicine and all that stuff. So in Sweden, is it like you have to get prescription always from the physician and then you get it, or you can go and directly buy from the pharmacy? How does that work?
Some medicine like paracetamol, ibuprofen, you can buy without prescription, but otherwise it's prescription from the doctors.
Okay, so it's like
Uh,
it's like over the counter. You can buy a few things, general,
yeah, yeah,
the
yeah,
usual ones for minor minor diseases, and then rest of it prescription based. Okay.
yeah. So like opioids and antibiotics, it's always prescription.
Yeah.
So that's good.
Yeah. Okay. And well, I guess much of your work is also focused on health literacy, right? So what
Yeah.
does that actually mean in practice? How can improving it will change the care delivered? Can you talk about that?
Yeah. Health literacy simply means being able to act and understand health information in your everyday life. It's about knowing what your blood pressure numbers mean, how to take antibiotics responsibly, or when to seek care versus when you can manage something at home. In practice, it's not about giving people more data. It's about giving them confidence when to seek, when to not, etc. And I think that if people feel empowered to understand their bodies, they make better decisions. They avoid unnecessary visits and they get help earlier if they need. And for healthcare system, improving health literacy it's like adding another layer to the prevention. It reduces pressure, saves resources, and most important, it helps people feel in control of their own health.
Right.
So that's for me.
Okay. And I know, we talked about this, that you are also building a certification, health-wise certification for schools and workplaces. I guess give us a little bit idea what it will be, and or what it is, and what will it take to get that health literacy embedded into the institution, workplaces, and they're not just, people are not just looking into always apps and clinics, right? That's where people do.
Yeah.
So talk
Yeah.
bit what you are doing with that, and what's the goal you're trying to achieve. How would you, I guess, embed it into the institutions, workplaces, and
Yeah.
talk about what you're planning to do with it.
I'm actually this is really on the development stage, but I'm creating like digital courses. Two are almost ready, and my plan is to like make a health certification and for workplaces with those. They're digital courses, and like workplaces they can market themselves like, oh, we're health certified workplace, and maybe also like give them health kits with blood pressure monitoring devices and so. And for schools, I'm I'm creating some kind of board game programs for health, because I think that it should be fun. We need to. It doesn't need to be boring. We need to make it fun. So board games and maybe like different apps, digital apps as well. Just making it fun. And I think this could be the key, like moving health literacy from like an add-on to really make it a part of how we're designing our institutions. Like, I think this should be a mandatory subject in school. Actually, it should be like as natural as teaching math or language. It should be there.
Yeah. Even I feel like I think that's like a very good point here. Like even in daily life, right? Even if we are now using so many devices, we're using Apple Watch to measure something, we're doing something else. uh, Not everyone knows what to do with even that.
Yeah.
Even though, like, I have my phone, it has the health data every day, right, on Apple, but even I don't know what all things are there. Like,
No.
I just know everybody just knows steps, and
Yeah.
at max everybody knows some heart rate, and that's it, right? So we
Yeah.
don't know general population, and I'm saying, like, somebody who's also has a master's degree, and even I don't know, like, what's beyond it, right? The medical field, right? What should we be looking at? And
Yeah.
these are the things we don't even need to buy. It's already embedded in the system. It's getting tracked somehow with our phone
Yeah.
devices. So I think there is definitely something there that, like how you said, can we teach the kids and also teach the employees in some way that that things you should care, and then also tell them, like, oh, if a few things that they should be able to measure by themselves, like, whatever that may be, right? So,
Yeah.
and especially at the school level, I think that's a good part, like how if you can gamify this and show it to the kids and make them learn, that would be actually a very sweet spot if you can get them, because then you're getting kids started way early. They know what to do in certain situation. I think what, even to this day, right, in schools, only thing we talk about is first aid kit or CPR, and that's it. That's what
Yeah.
this is like,
Yeah.
and this is there for last 20 years, right?
Yeah.
So nothing has changed beyond it, right? And I think the technology has moved forward so fast, and there's so many things that you can now do it on your finger.
Yeah.
So
Yeah. But still, like you mentioned the Apple Watch, and it's really good, like, to track some of your data. But I feel there's a risk that we're over tracking, because maybe for me it's like, okay, if I walk 7,000 steps a day, I'm happy. I know what I'm eating, and if I eat like vegetables and fruit, that's fine. And I go to sleep. I know if I sleep my 8 hours, I know I need 8 hours sleep. Then I wake up and I feel like I have slept well. Then I don't need to trace it, because I think that could also create a lot of health anxiety. So I think we're on the verge of too much tracking.
yeah,
For
yeah,
me, it's more like back to basic. Cook your meal like with good products. Go out in the nature. Spend time with your children or family. Don't sit all day in front of the screen. A lot of back to basics, and I think that will take us so far.
yeah. It's like we talked about in one of our other shows with Dr. Rudy, and he says thing orthorexia, which is you're overtracking
Yeah,
everything,
yeah,
and then you are ending up even having food disorders and other things,
yeah,
like, and everything in medicine also comes down to doing the basics. Like, if you do,
yeah,
the big changes in life comes from these very boring things, which is like movement, sleep,
yeah,
nutrition, and
yeah,
social connection, and
Yeah,
those things, and maybe supplements on top of it, some of it, and that's it.
yeah,
Right? Like that's the
yeah,
basics. You have to do it. So it's the problem is we're not doing basics, right? That's what it is. So
yeah, yeah. That's our problem. I think most of us.
yeah,
But that's what we need to learn. And like obesity is really rising in the world. So, and I think that's also kind of like unknowledge. People really don't know, like just the phrase energy in, energy out.
yeah,
I use that a lot with my kids. Like we can eat a lot of candy someday or some extra snack or something, but if you eat a lot of like energized food, then you also need to move more.
yeah, yeah. That's balance. That's what it is, right?
Yeah, yeah,
Okay.
it really is.
Um, let's talk about you have written about your dream of opening a rural clinic. Uh,
Yeah,
So, and you want to complete with therapy, dogs, and community connection, which is the thing that you emphasize. So,
yeah.
what is the vision behind it? What do you want to do, and what do you think? Like, I guess, do you think the future of care has to look more human in that way?
That, that's what I don't know if it has to, but that's how I want my care to be. That's what I want to practice. And I have so many nice colleagues that really, really just want to do the best for our patients. And we're stopped by bureaucracy and overwork, over a lot of work. So, yeah, I really think like I want to have, workshops, lectures, a lot of focus on social connections because loneliness is such a huge problem. Uh, Take a walk with your doctor, uh, walk and talks, a lot of things like that. And also, I'm a really a dog person, and I know how much like when they have therapy dogs at hospitals and so it really lightens the day.
Yeah.
So that's really my dream.
Yeah. Have you done this to your practice already? Have your dog and go with it and try it, how people take it. Is it allowed even to take dog to
No,
oh.
no. That's why I have to have my own clinic for it.
Yeah, yeah, yeah.
So my plan is to build a Proact Life really big, make the world know about it and use it, and then I want to sell that and be able to start my clinic with my dogs and my nice colleagues.
Yeah, yeah. I mean, you still want it in rural place? I mean, I believe like there's not many people in Sweden anyways. so, so it's already probably in American level. We say I'm thinking, oh, it's only 5,000 people in this town.
Yeah, but that was a really small town,
It's a really small town. Yeah. Okay.
but it's still a town.
Yeah. It's not like completely, 100 families. Not like that situation.
No, no, no.
Interesting. Hopefully that will happen sometime soon, and hopefully Proact Life will get better and bigger. Uh,
Yeah, it
and
will be.
yeah, and I guess let's do this like a quick fire round based on what comes to your mind first.
Yeah.
Uh, Tell me what you think, and I'm going to ask you two, three questions on that. Okay. So, one Swedish value that deeply influences how you practice medicine.
I don't know if it's especially Swedish value, uh, but I always think of that life is really hard for everybody. everyone struggles with something, and we don't always know what it is, but everybody struggles. And that mindset helps me to like listen and hear every patient out, and try to meet them where they are.
Okay.
Really listen.
Okay, that's not many people do that, so that's a good thing. Uh, a health myth or a piece of advice you wish we could forget about it forever.
Yeah. I will start by saying that I love quick fixes.
Mm.
That's silver tape is my favorite. But like, imagine that you can fix your health with a quick detox or something that we can throw away. Real health comes from like long-term solutions.
Yeah, a lot of people in Silicon Valley won't like you for this. All they do is this weekend detoxes or something, trying to do.
Sorry.
Uh, okay, and what's something surprising or even joyful that's come from starting Proact Life?
For me, it gives a lot of hope for the future, because I really think this is a good idea. And I never seen myself as a person with a lot of ideas, but apparently I am, and it's really funny because now that I'm starting this, I get a lot of small ideas. Like my brain is like a popcorn machine, and they will get new ideas, and I really get a lot of energy from all those ideas and trying them out. So that's really fun
Well,
for me.
so you're saying not only hope, it has also kind of reignited your thought process.
Yeah,
Now,
yeah.
now you get also a whole bunch of new ideas to also work towards. That's amazing. Okay, cool. Well, this has been great. Thanks for your time. Much appreciate for the conversation. If our listeners want to get in touch with you, what would be the best way to reach out to you?
I guess LinkedIn, because that's I'm actually not. I have never been a social media person before, so it's all very new to me.
Okay.
So LinkedIn is like the only thing I actually use right now. I will start with Instagram and TikTok and everything, but I'm not really a technical person.
That's okay. I mean, most people in healthcare are like that.
Yeah, yeah,
We're still always playing catch up with the tech.
yeah, yeah.
All right, cool. Any last word for our listeners before we conclude today's conversation?
Yeah, if there's one thing they should take away, is like, healthcare shouldn't just be about treating diseases. It should be about protecting health before it breaks out. And knowledge is medicine. And when people understand their health, they make better choices, and the whole system works better as well. And as we move forward in the future, it can't just be health tech. It has to be both human and tech, the combination.
Yeah,
Never forget the human connections in medicine.
yeah, very well said. I'm all good. I'm all for tech, but I don't think that medicine can go without having that human connection or human element to it. It just doesn't work. That's not how
No,
healing works. So it's just not going to work. Um,
no.
Well, that's been great. Thank you so much for your time, and thank you for, I guess, educating us a little bit on the Swedish health system.
Thank
And
you as well. It was really nice.
yeah, likewise. And wish you the best for Proact Life, and hopefully, when it's slightly bigger, then we'll get you back again to talk about it and have you
Thank
again.
you.
All right. Thank
Thank
you
you
so
very
much.
much.